As we heard in Shihab's report, their results from trials for a vaccine being developed by the company Moderna showed it was nearly 95% effective. Meanwhile, final stage trials begin here today for another new coronavirus vaccine, with scientists looking for 6,000 volunteers across the UK. Well, Rachel Younger joins us now. Rachel, what are the details of this new vaccine then?
Well, the second one you mentioned, the one that begins its phase 3 trials here in the UK today, that one's made by a company called Janssen, part of the Johnson & Johnson group, and it works in a similar way to the Oxford vaccine we've heard something about already, which that uses the modified common cold virus to train the body's immune system to fight off COVID. Now, we know from its stage 1 and 2 trials that it produces an immune response, and what we'll find out from the trial involving 6,000 people here in the UK and 24,000 across the rest of the globe is how safe and efficient it is. Now, if that trial result is good, then that could be made available here in the UK by the middle of next year, and the government already has 30 million doses of that on pre-order. But I think the really important good news story globally today is that Moderna vaccine, because that is a long way ahead and it was trialled on 30,000 people in America. The reason why that's so significant is because that sample included the elderly. It was a very racially diverse sample. It had also included people who already had underlying health conditions. So for it to get the kind of results it has is very promising. But I spoke to one expert in the area earlier today, and he said, look, it is not exactly a race here, because it won't just be one vaccine that gets rid of the pandemic. He says every single one is a real cause for optimism.
It is a good cause for optimism because we have vaccines from different platforms all producing good results. Therefore, I feel we will have more than 1, 2, 3, 4, 5 different platforms for us to use in different parts of the world, and that is the good news.
And of course, we do need to be cautious. These are still in trials, but I think that it gives us a really good ray of hope here that over the next few months we will have a choice of vaccines, and different ones hopefully working well for different groups of people.
Hopefully. Rachel, thank you.